Hello, my name is Noah Rosen, and my community project is about the diet requirements for patients with Duchenne muscular dystrophy. Also, I am very sorry for the watermark. I can't remove it unless I pay extra. Okay, here we go. Duchenne muscular dystrophy, also known as DMD, is a genetic disease that affects roughly 1 in 3,500 people. DMD affects many aspects of a person's life, both physiologically and emotionally. Therefore, a multidisciplinary approach is necessary for proper treatment of the disease. A typical hospital visit for a DMD patient could include seeing several doctors, such as geneticists, cardiologists, therapists, and orthopedic doctors, to name a few. Additionally, DMD patients have specific nutritional requirements, and it is imperative that they regularly see a clinical dietitian to ensure that their health is maintained. DMD patients are not able to move around very well, especially once they lose ambulation and require a wheelchair, and it is common for them to gain weight due to lack of exercise. It is important for them to maintain a specific calorie intake so that they don't gain too much weight. DMD affects cardiac muscle just as it does skeletal muscle, and cardiomyopathy is a common cause of death for DMD patients. Obesity is associated with an increased risk of cardiovascular disease, so it is especially important for DMD patients who already have an increased risk of heart failure to maintain a healthy weight. Additionally, certain nutrients, such as calcium, are beneficial for DMD patients, and it is advised that they eat a specific diet of foods that are rich in the nutrients they need. Lastly, various pharmaceutical treatments that the patients may be on, such as glucocorticoids, have adverse side effects, like bone density loss and weight gain, that can be mitigated with a proper diet. In order to reduce the possibility of undesired weight gain, it is advised that DMD patients consume about 80% of what a person of similar size without DMD should consume. Drinking enough water is extremely important for patients with DMD. Proper hydration will help prevent constipation, which can be caused by lack of movement. For example, it is recommended that a teenager with DMD has about 11 cups of water a day. As previously mentioned, DMD already affects bone health, but steroid treatment, which many DMD patients are on, additionally affects bone health. Therefore, a diet rich in vitamin D, calcium, and protein is necessary in order to prevent loss of bone density. Low-calorie foods high in vitamin D and protein include fish, eggs, and mushrooms. Also, sunlight provides the energy for vitamin D synthesis in our skin cells. Dairy products, like milk and cheese, or dairy alternative products, such as almond milk, are rich in calcium. A diet rich in fiber is also important and can help prevent constipation, which is common in DMD patients. Fruits, like apples and blueberries, are the way to go. Vitamin D and calcium pills are often taken daily to supplement their diet. Lastly, it's important to remember that these are generalized and simplified guidelines. Each patient is unique and requires a dietitian to come up with a diet plan that is specific to their needs. Age, progression of the disease, weight, height, symptoms, and current treatment plan are unique to each individual and are considered when coming up with a diet plan. Additionally, dietitians monitor the levels of various nutrients in the patient, such as calcium levels, and also how the patient is responding to their diet, and they can adjust their diet plan accordingly. Thank you very much for listening. I hope you enjoyed my presentation on the diet requirements for patients with DMD.